I would like first to thank the organization committee for the invitation, and it's really a pleasure for me to be with you in this third edition of Global Conference on Gynecology and Women's Health to share with you this presentation. So to share in this presentation the results of a study we conducted in Fertility Center in Tunisia. So my presentation will not be very long. So a successful implantation needs a good quality embryo, a receptive endometrium, and a synchronization between endometrium and embryo. So when we perform an embryo transfer and there is no pregnancy, this is an implantation failure. The cause of one implantation failure can be just a bad chance. Why just a bad chance? Because it can be an embryo expulsion. We can have the good embryo, the receptive endometrium, and a good synchronization, but unfortunately, we have something called embryo expulsion that can happen after embryo transfer. When we look in literature and especially in a study of Paul Pirty and all entitled rate of true recurrent implantation failure is low, it appears that embryo expulsion is not rare, as it concerns about 30 to 40% of the embryos transferred in IVF. This phenomenon is due to uterine peristalsis, and it was proven that uterine peristalsis affects the chance of pregnancy after transfer in IVF. And the chances of pregnancy decreases drastically when the number of uterine contraction is 2 contractions per minute or more. Many studies and meta-analyses found that the administration of an oxytocin receptor antagonist around embryo transfer increases IVF success by reducing uterine peristalsis. The problem with this treatment is the cost. It's about $100 per embryo transfer, which is relatively expensive, especially in our condition. So we tried to search other ways to reduce uterine contraction after embryo transfer with a less cost. We found in literature that magnesium and stress are associated to uterine peristalsis. In a study published by Fahd and al. In 2022, the authors used an infusion of a single dose of magnesium sulfate before embryo transfer, and they found a non-significant increase in clinical pregnancy. This is the only study that we found in literature searching magnesium in the chance in embryo transfer. So we did a study. The objective of our study was to try an association, a single administration of an association of oral magnesium and oral anxiolytic to reduce uterine peristalsis and so to increase embryo implantation. The study was conducted at Fertility Center in Tunisia between January 2024 and December 2024. The study was approved by the local ethics committee. So were included in the study patients planned for fresh or frozen embryo transfer of 2 embryos, day 3 or day 5 embryos. Were excluded from the study patients of 42 years or more, patients with uterine malformation, endometriosis, adenomyosis, single embryo transfer, difficult embryo transfer, and patients with repeated implantation failure. And patients provided written informed consent before being included in the study. Patients were randomized the day of oocyte pickup for fresh cycles or the day of the transfer decision for frozen embryos. In the study group, patients took a single dose of 400 milligram of magnesium bisglycinate and 1.5 milligram of bromazepam 2 hours before embryo transfer. Clinicians were not informed whether the patient was in the study or control group, thus the clinicians were blinded to the state of the patient. 297 patients were enrolled in the study, 100 in the study group and 197 in the control group. Donc, when we look to the baseline characteristic of our patients, the two groups were comparable in age, BMI, and fertility duration, and the number of day 3 and day 5 embryo transfers. Concerning pregnancy outcomes, we did not, unfortunately, find any difference between the two groups, whether in fresh or frozen embryos transfer and in the day 3 or day 5 embryo transfers. So the same global clinical pregnancy rate and the same pregnancy rate in all groups. So the only studies that tried magnesium, as I said it earlier, found that magnesium sulfite group had non-significantly higher implantation rate, clinical pregnancy rate, and live birth rate than control group. So they had an increase in chance, but that was not significant. And they tried an infusion of magnesium. Concerning stress that we studied also in our study, so studies on stress management and IVF found encouraging results regarding the positive effect of interventions for stress management in women undergoing fertility treatment. However, the possible contribution of such interventions to overall IVF success rates requires further investigation. And in a recent systematic review on stress and IVF success, authors found that only one study was associated acute stress with pregnancy rate. All remaining studies, however, didn't show any statistically significant difference. So, in our study, punctual administration of magnesium and anxiolytic the day of embryo transfer did not improve IVF results as the antagonist of oxytocin did. The cause can be and is probably the fact that the antagonist of oxytocin is more effective than magnesium on uterine contraction. And also the effect of acute stress on uterine contraction and IVF results is actually uncertain in the new studies. So we have proposed a new study. So as punctual administration of magnesium and anxiolytic the day of embryo transfer did not improve IVF results, and as embryo usually implants on day 6 or 7, we think that we will try nearly more prolonged oral administration of magnesium, and this time we will use fluoroglucinol to cover the period from embryo transfer to embryo implantation. So we will use a longer period of oral administration. So we will associate this time fluoroglucinol as recent studies found a positive results with this molecule. Before finishing, I want to thank some person that contributed in this study as Dr. Semidi Falla and Dr. Ines Zidi for their clinical contribution, and Dr. Mariam Kahlawi for data collection and data analysis, as well as all the team of Fertility Center. And I thank you.